field, or my role in Orlando Orthopaedics is a little unique. I am actually a non-surgical physician. My training and background, my initial training was in pediatrics and specialized in sports medicine. But it's more accurate to say that I take care of any young, active individual. I end up seeing some middle-aged folks as well with some degenerative conditions or overuse syndromes, but by and large what I take care of are any type of ailment that affects active individuals. And that could include musculoskeletal injuries, which includes overuse problems, knee problems, fractures, etc. But it also can include any type of medical ailments that affect an athlete, in particular concussions, any kind of exercise-induced asthma. Those types of ailments are also things that I've been trained to take care of. So I basically kind of take care of the athlete as a whole. And again, it's more of an active individual, I like to say. Not everybody's on an organized sports team, but I do take care for anybody that's active. And so I address their complaints both medically and orthopedically. And my goal, of course, is always to get the most potential out of my patients as possible. I have a non-surgical approach, and I'm trying to get them back on the field or back into their daily activity as best as they can so they can maximize that potential. Well, when you're looking for a sports medicine doctor, I think it's important to, first of all, be sure that doctor has, obviously you want to have the experience. I mean, they want them to be experienced in taking care of those types of injuries or illnesses that you're seeking recommendations on. I think it's always helpful to find somebody that has a specific interest and knowledge of the demands that are required for that sport or activity. In particular, knowing, for instance, the specific problems that is encountered by a runner or a baseball player, knowing that there are very unique situations that come up pertaining to those athletes or to that activity. And so you kind of really want to know that that person has either experienced that themselves or at least has plenty of experience being around that situation, around that sport, around that activity, enough to know what people struggle with. And obviously you kind of want to find a personal fit. You want to find somebody that you trust and someone that takes some time to go through your problem with you. But it's expected, it's understandably difficult sometimes to find that. Sometimes it takes a little trial and error to find the right fit. But ultimately that's kind of what you're looking for. Well, in general, before coming in for any appointments, it's most important to understand it's about you. The first thing you need is just relax and know that nobody's judging you. There are no stupid questions that you can ask. We're not expecting a patient to be an expert on their condition, or they wouldn't be there in the first place. So, first and foremost, there's no such thing as a stupid question. There's no such thing as, oh, I shouldn't have come. I mean, if there's a concern, we always want to help to address that. And even if it seems like it's a trivial thing, it really is not. So, first and foremost, put those anxieties behind you and understand that we'll help you figure out what it is. It may not be a serious problem, but you know what? Even the non-life-threatening illnesses or non-threatening injuries are things that we can still help you through those problems. If it's holding you back from what you want to do, it's still important. So I think it's important to put those anxieties aside. Come in and just give us the information. We'll ask the questions, and as much information as you can provide will help us to get down to the bottom of what's going on. But other than that, it's just we'll take care of the rest.